Welcome to the new episode of Health Basket. So the bone density, it peaks at the late 20s and gradually the bone density decreases, it goes down. So at mid 40s, our bone density keep on decreasing as the age advances. There are many ways to maintain the bone density: the weightlifting, strength training, walking, little bit of exercises, and the knowledge about various food and vegetable requirements. All these things helps in maintaining the bone density at the mid 40s, mid 50s. So as the bone density decreases, we have this problem of osteopenia, and then further it progresses to osteoporosis. So what all can be done to maintain this bone density so that the fracture percentages falls down and the risk of fall which will lead to the fractures falls down. So the first important thing is weight lifting, strength training. These exercises which keeps load on the bone increases the matter inside the bone, the density increases according to the Wolff's law. So as and when we do exercise, we keep stress on the bones and joints, the bone expands and then the bone density increases.
Health tips for healthy life. For more such health tips from our senior doctors, subscribe to Health Basket YouTube channel and click the bell icon to get notified. Stay connected to us through our social platform. Protect yourself from the COVID-19 pandemic by building your immune system. Let us join hands to make the world healthy.